Hi, everyone. My name is Emily Tucker, and I'm a senior health studies major here at Monmouth University. Over the last year, I've had the opportunity to research barriers in accessing healthcare faced by Indigenous Guatemalan communities and how non governmental organizations target their aid and relief to address them. This area of interest was inspired through my time in Guatemala in the spring of 2018. It was in this trip where I first became aware of the many disparities in health and education. This experience has fueled my passion for global public health and has guided my research. So let's get started. The Office of Disease Prevention and Health Promotion explains that access to healthcare includes the timely use of personal health services to achieve the best health outcomes. Gaining access to health services requires entry to the healthcare system, geographic availability, and creating a personal relationship with the healthcare provider to trust and communicate health concerns with. When there is a gap in these three components, it is referred to as a barrier to healthcare. Barriers in accessing healthcare ultimately prevent access to treatment and resources that contribute to overall health. According to the United Nations, there are a known 370 million Indigenous people across the globe who face considerable barriers to health. Over 40% of the Guatemalan population identify as Indigenous. They have different beliefs, cultural practices, legal systems, and are typically more resource scarce. As a result of this, they face more barriers in accessing care and worse health outcomes overall. The World Health Organization emphasizes that within global health, there are differences in the status of health not only between countries, but also within countries. This is the case when analyzing the barriers to health faced in rural versus urban communities, as is also the case in Indigenous versus Ladino or non Mayan Spanish Guatemalan communities. An example of the differences between rural and urban communities can be depicted through child stunting. Stunting is a health condition that is prominent in many low income countries. According to the World Health Organization, stunting is the result of infection, illness, inadequate nutrition, and minimal social stimulation. This condition is distinguished by a low height to age ratio. Data collected by UNICEF in 2010 analyzed the rate of child stunting based on geographic location. Research shows that stunting in children under the age of 5 was 2.5 times more likely for children who lived in rural areas. Comparatively, children who lived in urban areas with closer accessibility to hospitals, clinics, and markets showed less instance of stunting. This data is represented in Figure 1. In reading the literature, I came across 5 major themes. These included war and historic prejudice, ethnic inequality and discrimination, education, language, and accessibility. Accessibility encompassed several distinct components. These included geographic location, availability of resources, finances, and cultural acceptance. Though the literature review indicated multiple areas that influence ability to access healthcare services, for the purpose of this research, only 4 barriers to health will be used as the basis of this content analysis. These barriers were selected based on relevance to health. They include education, language, specifically the consideration for the Mayan language, location, and cost of service. Additionally, I will address the COVID-19 response and its implication for the future. The United Nations recognition of education as a social determinant of health in developing countries emphasizes the importance of reducing its effects on vulnerable populations. It is crucial to recognize that education as a social determinant to health is multidirectional. Not only does education influence health, health also influences education. As a result of this, minimal access to education is detrimental to the physical and social well being of individuals because it contributes in reducing ability to attain access to healthcare. Poor health affects education. Disease, malnutrition, chronic illness, and disabilities all have established links to poor performance in school and minimal attainment of educational material. Education also affects health. Education has the potential to create new opportunities for communities to practice effective health methods, receive health services, and maintain overall well being. Research indicated that individuals with experience in school have greater confidence in their ability to maneuver through the healthcare system. It has been concluded that even the most basic level of education has substantial benefits to health and overall well being. Lack of education inhibits the fundamental growth of a community and is detrimental to the health of its members. Without proper health, populations are unable to achieve academic success. Similarly, without proper education, access to and understanding of healthcare services can potentially be minimal, leaving a population vulnerable. Evidence shows that language serves as a major barrier to health for Indigenous Guatemalans seeking medical services. Guatemala's native language is Spanish. However, Indigenous populations in Guatemala communicate in a variety of traditional Mayan languages. In rural areas of Guatemala, there are approximately 22 different Indigenous languages spoken. Language barriers occur when patients seeking medical services are unable to communicate with practitioners. Literature and research are unable to determine the best means to eliminating this issue as a barrier to health faced by Indigenous communities. Should medical professionals be equipped to speak a variety of Indigenous languages in order to provide the best care possible? Should members of Indigenous communities who request services be able to speak Spanish? Do clinics require the use of translators? As you can tell, there are many ethical concerns within each of these potential solutions, which makes language a difficult barrier to face. Geographic location refers to the distance from a community in which medical services are located. This includes the distance from the community to a hospital or clinic where a physician can be seen. Geographic location also includes how long it will take for a patient to reach these locations. For Indigenous populations in rural Guatemala, accessing these facilities can be hindered by the availability of transportation and inclement weather that reduces the ability to walk to the desired destination. The World Health Organization has declared that in addition to providing equal access to health products and services, effective healthcare systems are expected to protect individuals from the financial burden of incurred costs from attaining healthcare services. Financial fairness in accessing healthcare services is one of the components to a well-functioning healthcare system, according to the World Health Report of 2000. Unfortunately, finances are a key barrier in the accessibility of healthcare services for many communities in middle to low-income countries. Research indicates that the financial harm resulting from accessing healthcare services and products within any given healthcare system has the potential to prevent patients from seeking and attaining medical assistance. Financial protection, most commonly known as insurance in the developed world, is not a service commonly provided for Indigenous communities. This research aims to clarify the roles of non-governmental organizations and whether they are reducing barriers to healthcare for Indigenous Guatemalan communities. The purpose of this study was to determine which barriers are more prominently addressed in the scope of NGO work and which barriers need more attention. A content analysis has the ability to highlight specific areas of focus for NGOs. By conducting a content analysis, organizations can be compared in key areas of concern. This analysis will address what these organizations claim they are doing in Guatemala to address barriers and meet the needs of Indigenous communities. NGOs were selected through a multi-stage selection process. In an original Google engine search of non-governmental organizations Guatemala, the first link made available was to an organization called Global Giving. The Global Giving search engine then created an opportunity to filter organizations to only show NGOs that were related to the keywords health and Guatemala. A sample of 22 organizations and their websites were then analyzed for specific content related to the barriers in accessing healthcare. Each organization was analyzed separately in order to determine which barriers they were attempting to alleviate and which barriers, if any, were unaccounted for. Of the organizations included in this content analysis, 91% were involved in providing educational resources, opportunities, facilities, or programs that were targeted toward health promotion and prevention. However, The specific area of educational focus differed depending on the mission of the organization. Each organization highlighted a different primary focus, with projects targeted to the specific component of health. Programs provided education in areas ranging from dental hygiene, agriculture, and nutrition. Though each organization addressed the connection between education and accessing healthcare differently, each organization addressed this relationship in their mission and throughout their content. 55% of organizations analyzed addressed language as a barrier to health within their content. However, their direct alleviation of the language barrier in accessing healthcare is debatable for some organizations that only provide translation services from English to Spanish. This accounted for approximately 23% of organizations. As mentioned, the language barrier, specifically in the Indigenous Mayan communities, exists also between Spanish and traditional Mayan languages. Within the organizations that address the language barrier, 7 organizations address language as a barrier to health by providing services in traditional Mayan languages. Of the 32% of organizations that provided services in one of the traditional Mayan languages, a common trend was the employment of native speakers in Guatemala. This has the potential to enhance cultural knowledge, sensitivity, awareness, and competency within the organization. Only 36% of organizations failed to mention the geographic location of the services they provided. Of the remaining majority of organizations that did provide reference to their location of organizational operations, only 22% of organizations provided an image or exact location that depicted their geographic location. A physical example of their location, like a map, for instance, can serve to provide context for patients in terms of travel. It can provide additional information for individuals seeking services in order to determine how close or far their primary residence is from the organization's base. Though a simple contribution to the content of a website, a map can provide additional useful information for patients regarding the geographic accessibility of services. 81% of the sample did not directly mention financial accessibility. However, cost was mentioned in reference to the financial report when addressing the overhead costs of running the organization, grants, and additional donations. Direct cost for the individual receiving services was not mentioned by the organizations. There was no mention if the cost of services was limited or non-existent to the individual receiving assistance from the organization. In terms of donation-related finances, organizations accepted monetary donations and medical supplies. Images were frequently used to explain the value of a donation within each community and within the context of each project. This content analysis simply adds to the literature about what organizations are targeting their mission towards in terms of alleviating the barriers associated with accessing healthcare. A content analysis cannot be used to generalize other non-governmental organizations. It is also difficult to determine whether or not an organization is good or bad based off their website content. Additionally, it is difficult to determine if an organization is acting on their mission based off of the information they make available to the public. The findings of this study may vary based off the researcher's perspective of what content can be applicable to each criteria. In all, the content of a website is only a superficial component of an organization and cannot fully determine the accuracy of claims, effectiveness, effort, or lack thereof in reducing the barriers to health faced by Indigenous communities in Guatemala. Other findings to consider is the impact of the COVID-19 pandemic on organizational response and relief. Despite mention of addressing multiple barriers to health, the content produced by the organizations may not be physically carried out due to this global crisis. In the case of the COVID-19 pandemic, many organizations have opted to discontinue services globally in an effort to protect their staff and patients from the further spread of this virus. Within the Monmouth University community alone, 3 programs to Guatemala in the spring of 2020 were canceled due to the COVID-19 pandemic. Within the Monmouth Alumni Network, an additional program to Guatemala for the summer of 2020 was canceled as well. Therefore, while intent has been made to address the barriers to accessing healthcare faced by communities in Guatemala, there may not be any real action in alleviating these barriers at the moment. Within the organizations evaluated, less than 50% address the impact of COVID-19 in their efforts to alleviate the burden of disease and address the additional threat it poses to pre-existing barriers in accessing healthcare. These findings are crucial to the evaluation of this content analysis because the current situation plays an extensive role in the presented content and the actual work that can be accomplished.